Hello all, today we will see clinical presentation and management of anaphylaxis. Anaphylaxis is the exaggerated immunological response to a substance to which an individual has become sensitized. Histamine, serotonin, tryptase and other vasoactive substances are released from basophils and mast cells. Another entity, anaphylactoid reaction, is different from anaphylaxis, but it is clinically indistinguishable from anaphylaxis. In anaphylactoid reaction, it is mediated by the drug or substance directly, but not by sensitized IgE antibodies as in anaphylaxis. Next, clinical presentation can affect all the systems: cardiovascular, respiratory, gastrointestinal, hematological, cutaneous. Cardiovascular system: hypotension, cardiovascular collapse, tachycardia, arrhythmia, and ECG may show ischemic changes, cardiac arrest. Respiratory system: edema of the glottis, edema of the tongue, and edema of the airway structures, stridor and airway obstruction due to the edema. Gastrointestinal: abdominal pain, diarrhea, vomiting. Hematological: coagulopathy, cutaneous, flushing, erythema, urticaria. Next, management. First of all, call for help and then initial assessment and treatments based on ABCDE approach. Drugs used in anaphylaxis: intramuscular adrenaline, usually given in androlateral aspect of medial third of thigh, and IV hydrocortisone, prevent or shorten protracted reactions. IV chlorpheniramine, it's an antihistamine and it's a second line treatment, and it counter histamine mediated vasodilatation and bronchoconstriction. Next, IV fluids, it restore circulating blood volume in anaphylactic shock. So first, patient positioning. Patient should be placed in comfortable position. If a patient is conscious and there is airway and breathing problems, patient may prefer to sit up as this will make breathing easier. But if BP is low, patient should be asked to lie flat with or without leg elevation. And if patient is breathing but unconscious, patient should be placed in recovery position on their side. In case of pregnant patients, they can be placed in left lateral position to prevent vena cava compression. Next, remove the trigger if possible, that is, stop the drug or influid suspected of causing anaphylaxis. Remove the sting if the anaphylaxis is caused after a bee sting, but don't try to induce vomiting if the anaphylaxis is caused by the food. Next, if there is cardiorespiratory arrest, cardiopulmonary resuscitation should be started and immediately call for help and immediately transfer to hospital. So coming to ABCDE approach, first A, airway plus assess need for IM adrenaline. IM adrenaline, the dose can vary, depends on age. Concentration is 1:1000 and 0.5 ml in adult and children more than 12 years. And assess the airway, relieve airway obstruction. Next, breathing plus administration of high flow oxygen. So assess breathing, look for any signs of bronchospasm or respiratory distress like rapid respiration, wheeze, fatigue, cyanosis, saturation less than 22%. Bronchodilators can be administered if wheeze is present, and bronchodilator therapy with salbutamol can be used either inhaled or IV. Then circulation plus administration of IV fluids. C. So patient, if there is shock, patient may feel cold or clammy to touch, and there will be tachycardia and prolonged capillary refill time, low blood pressure, and may present with collapse or faintness. And so get an immediate IV access and put a large bore IV cannula and start IV fluids. Next, disability D, that is whether patient is responding or unconscious. We can use AVPU criteria: alert or response to visual painful stimuli or unresponsive. Next, exposure E. Adequate exposure of skin and look for any rashes or urticaria. Next, finally, follow-up care. Patient should be observed for at least 6 hours or longer. May observe for about 24 hours in case of severe anaphylaxis. Warn the possibility of an early recurrence of symptoms. Antihistamines and oral steroid therapy can be given for up to 3 days. Adrenaline auto-injector can be advised to keep with the patient. Then we can refer the patient to an allergy specialist. Then written self-management plan, and we should give information about anaphylaxis. Thank you.